There is a crucial moment that happens right after birth that you as a dad or birth partner needs to help defend: the golden hour. Your baby should be as close to mom as possible, as soon as possible, and for as long as possible with direct, uninterrupted skin-to-skin contact. You gotta hear why this complex neurochemical process is so critical and how you can make it happen. All this and more coming up.
This is the Paternal Partner. Hit that subscribe button and turn on notifications so you don't miss any of our future content.
This is hard work, of course. You won't be alone in your work. Your doctor will be working too, and will be ready to receive the baby as he comes out through the vaginal opening.
In the past, a new mom would watch their baby get immediately whisked away to undergo the examinations and cleaning and measurements, and after all that waiting, mom would finally get to hold that baby. And dads, you wouldn't get the chance to see that baby until much later. So what's changed? Why is that first hour after birth so sacred? And what exactly is skin-to-skin contact? Skin-to-skin contact is when baby is placed directly against mom's bare chest. And there is a surging oxytocin release when that happens. Oxytocin is known as the love hormone, and it's a pretty powerful thing. Oxytocin is a neurotransmitter and a hormone that's produced in the brain of both your baby and of you. This helps your baby regulate body temperature, because thermoregulation is a very common problem with infants, especially preterm babies. It helps your baby cry less. Studies show a newborn's initial cry is akin to a separation distress call. It's like a mammalian reflex to call the mom back to the baby.
Come here. Come here. Oh my gosh, okay. We're good. Oh, that makes me so reunited, and it feels so good.
That's pretty cool. This helps your baby with the promotion of healthy weight, with regulating heartbeat and breathing, by boosting their immune systems, and most importantly, to breastfeed easier, which is not always the easiest task. And on a side note for that, breastfeeding actually helps speed up the delivery of the placenta, which can help reduce the risk of dangerous hemorrhaging. It also helps your baby reduce anxiety and altogether just have an easier transition from the womb. It helps mom lower the risk of postpartum depression. It helps mom reduce anxiety. And it also helps mom foster a stronger emotional bond with the baby. But guess what? You as a dad, you should experience skin-to-skin contact too after that time. It's going to help you feel more confident as a father. It's going to give mom a chance to get a rest. It's going to help you reduce anxiety. And most importantly, it's going to help you quickly foster a stronger emotional bond. Because hey, as a dad, you don't develop the physical bond with your baby until after birth. And you might actually hear it referred to as kangaroo care.
The unusual way in which marsupials are born has been the subject of strange myths and legends for hundreds of years.
Skin-to-skin contact was first used in neonatal wards in Colombia in the 1970s when they had a shortage of incubators for babies with severe hospital infections. Neonatologist Edgar Ray and Hector Martinez turned to nature, specifically kangaroos. They hold their young as soon as they're born. It was a huge success, and the dependency on these incubators dropped drastically. Doctors watched as mortality rates dropped from 70% all the way down to 30%. That's pretty cool.
Don't go anywhere. We got a lot to tell you coming up. You digging our soundtrack? Get full access to cleared music like ours for content creators with Epidemic Sound. Link down below for a 30-day free trial.
So here's how you can help defend that golden hour. Hospital staff, nurses, home birth midwives, doulas, they're all really good at respecting the golden hour. This is not a new idea to them, but there's more to defending the golden hour than just communicating with them. First of all, talk to your birthing partner about what she would like to experience during that golden hour. And then communicate her goal for the golden hour into your birth plan. What? You don't have a birth plan? You should. But don't worry, we gotcha. There's a video all about birth plans explained for dads. There's a link down below, one up top, and then one at the end of the video. In that birth plan, you can put down things like, how long do you want the golden hour to be? Maybe you want that time alone with just the three of you. And be sure to talk it over with your healthcare provider ahead of time so that they're aware of your intentions. And then communicate all this to your loved ones, which are going to be waiting outside. Let them know you'll contact them after that golden hour, if that's your goal. You want this dad's suggestion? Spend at least an hour with direct skin-to-skin contact with that baby on mom's bare chest before you call anyone, before you let anyone else in the room. And when it's your turn, move that baby to your bare chest so you can have some skin-to-skin time. And once home, spend as much time as you and your partner can with direct skin-to-skin contact. So huddle up with that baby and enjoy the beautiful experience of being a dad.
We post new content every week. Stuff no one tells you about being a dad. Hit that subscribe button below and a little bell icon too so you don't miss any of our future content. Click on any of the videos over here to watch more.